Yeah, good afternoon, one and all, my audience, all present here today. I'm Dr. Chetan John Raskina from Hosmat Hospitals, Bangalore, and I'm specialized in trauma, joint replacement, as well as keyhole scopy surgeries. Special mention on knee and ankle surgeries as well. So I'm having around 9 years of experience and counting with Hosmat Hospitals Bangalore. So today we'll be talking about understanding more about your bones and joints, its aging impact on our lives. So many of y'all teenagers, as you know, the bones weaken after the peak age group of 30 years of age, where we have the peak body mass index as well as the bone age is maximum at that point in time. And then we go into a phase known as osteopenia, or the density starts decreasing, where you can further progress to osteoporosis. So my today's focus is mainly on the young age group, because a lot of us today, the IT and the professionals in various fields are not having enough physical activity or exposure to sunlight, which is causing silent disease known as osteopenia, which leads to osteoporosis. So, osteoporosis is a disease that causes your bones to become brittle and then again results in fractures. Simple traumas causing fractures. The estimated ages in a 50-year-old woman is around 40% of their bone mass would have been lost at the age of 50. So they are more prone for fractures. So, what do you feel? It is a silent disease. So, the symptoms are usually non specific joint pains, bone pains, enthesiopathy, we call it. So, wherein the muscle tendon junction or the bone muscle junctions, you develop certain pains, non specific again. Some people would have had it and ignored it. And then, when it gets too much, they come to the doctor. So again, the main goal is to catch these symptoms as early as possible and to treat it. So as you know, in osteoporosis, the bone mineral density is decreased. So wherein the structure, the normal trabecular pattern of our bones gets porotic, or it forms holes and leads to breakage. So the most common sites are your wrist, spine, hips. So, who are at risk, or the common risk factors are the female population postmenopausal. That is because during the menopause they have decreased estrogen levels, which can be prone to fractures. And family history of osteoporosis is there, more chance that the next generation can have. Lack of exercise, small body framework, low calcium and vitamin D intake. Then again, the man made risk factors of smoking, and if you have any systemic diseases like rheumatoid arthritis, hyperparathyroidism, and hypogonadism, medications, certain psychiatric drugs, diuretics, long term steroids, wherein people are into having a lot of respiratory issues and they are taking steroids for it, can lead to weaker bones. So what do you do? So many of us will ask ourselves, what will we do, and how will we know? So osteoporosis only has symptoms in its advanced stage. So, wherein the person might have fallen and sustained a hip fracture or a spinal cord, the bone, you'll have a wedge compression fracture, or in later stages, it is known as Dowager's hump or anterior bending, or kyphotic spinal deformities. Patients will have non-specific back pains, and even small trivial traumas can lead to fractures of the wrist or fingers. So what is the best method of detecting it? again is by bone densitometry, okay, or DXA test. It's an it What is DXA testing? It is a dual energy X-ray absorptiometry. So wherein it detects in specific areas in the body, like the hips, like your spinal cord, the lower end of your heels, etc., and gives you an average score. So it is just like an X-ray. So it is less invasive and painless procedure, and has lesser radiation compared to a normal X-ray, because a normal X-ray will not detect it until and unless around around 30% of your bone mass has been reduced. So this is a quick and painless method, and but not recommended for pregnant women. So again, we have three groups. So we categorize it according to the T score. Okay, how do we interpret it? Is the patient's chronological age of the patient is compared with the patient of the same age and same body mass index, and then you have what is known as T score. So a score of lower than -1 is normal, -10 is normal, below -1 to -2.5 is osteopenic, and below -2.5 is osteoporotic. So the people between the cautious level is between -1 and -2.5. So who needs bone densitometry? Anyone who wants to measure who is at risk, age group for ladies above 50, and men also as well, people who are having systemic diseases like either diabetes, or they are having some hyperparathyroidism, or on long term steroids because of their respiratory issues like asthma, bronchial asthma, on steroids like prednisolone, are at high risk and recommended to undergo the bone densitometry test. So the categories: estrogen deficient women, those who have already any spinal fractures evident on X-ray. We see patients in and out, and then incidentally we find that they are having a wedge compression fracture. And then again, patients who are on corticosteroids and primary hypothyroidism patients are ones who have to undergo bone densitometry. And also people who have been diagnosed osteoporotic and they are on treatment and remission, they have to know how they are faring. So that's when we do the DEXA scan. So how do you treat it next? Treatment is the key, and always there's a saying: prevention is better than cure. So it's always good to check. I always believe if it's your birthday or some special occasion, the basic is to do your blood tests against sugars, cholesterol. Along with that, we do what is known as serum calcium levels. We do the vitamin D testing, which has become common these days. So on that levels, we can find out whether the patient is osteoporotic or having less calcium levels. And then if the calcium level is below 9, okay, is when you need to treat the person. How do you treat? Normal calcium supplements in your diet, and you get also calcium tablets. So your daily intake dose is 1000 milligrams per day, most adults, and 1200 for the women over the age of 50. Okay, and 1500 for men over the age of 70. Vitamin D levels should be the normal recommended dose for vitamin D is again 400 to 800 international units for young adults, and that can increase to around 1800 to 1000 international units for people above the age of 50. Again, where do you get it? The natural source of vitamin D is the sunlight. So we always tell people, please expose yourself to sunlight when you do your daily activity. Again, how do you treat? The third step is physical activity. Physical activity, normal walking. I don't expect you to do any vigorous activity. Normal level ground walking for 40 minutes a day will help to generate or help in regenerating the osteoblastic activity of your body. So again, how do you treat when you are in the, that is when you're early detected, you treat with vitamin D and calcium. If you are at minus 2.5 t score and below, then we have certain tablets or drugs in injectables or in oral forms known as bisphosphonates. Bisphosphonates are nothing but anti-resorptive drugs, so they help to slow down the bone loss process. Okay, again we have different bisphosphonates like alendronate, recidronate, and in different strengths. So the second line is again calcitonin sprays, which is patient friendly and can be used as a nasal spray in alternate nostrils on alternate days. And these also are anti-resorptive, and they help to increase the calcium levels in the body, especially people with vertebral spine fractures. So coming to the third line, again perimenopausal women, it's very common. So we give estrogen replacement, hormonal replacement therapy with estrogen. So that has found to decrease the risk of osteoporosis on long term. Selective, then we have the fourth group of modality known as SERM, selective estrogen receptor modulators. But the only side effect with this long term SERMs drugs is it can trigger or lead to breast cancer. So then the fourth is injectable. So we call these group of drugs as teriparatide group of drugs, which can be administered, self-administered, for a period of 3 months course, like taking your insulin shots or insulin. It comes as a pen needle kind of mechanism. It can be taken on a day-to-day basis. This is only if you're severely osteoporotic. Again, young and pregnant women, the demand is more. We don't use all these group of drugs. We have to stick to only your vitamin D and your calcium, and make sure that post pregnancy, postpartum also, women are advised to take calcium for a period of 6 months. So again, how do you prevent? So how do you prevent is normal diet rich in calcium. Okay, again if you are vegetarians, you can take a lot of legumes and lot of your green leafy vegetables also. So a lot of patients come and say we don't eat non-veg, but egg and meat is a good source of calcium. Vitamin D, there's nothing better, though we have capsules and we have tonics, nothing more than natural free sunlight. Morning hours between 7 to 9 in the morning is the best time. Again, stop smoking, alcohol intake, and also do weight bearing exercises. Again, the best weight bearing exercise is to walk. So uh, what is the broader impact of osteoporosis on our health? So it's a serious silent problem like diabetes. So there are warning signs. So we have to catch those warning signs. If you have chronic pain off and on, you have those stiffness of joints, you wake up in the morning, you're having those muscle cramps, you're not able to wake up fresh, and even after going, and some of us go to the doctor, but it is undetected. So when they come to us as orthopedicians, these are the follow-ups we conduct to catch these people, the population early, who can whom where we can prevent osteoporosis. So what do we do when we are living with osteoporosis? Again, avoid slippery surfaces, remove hazardous things from the house, get walking sticks or certain safety proof toilets. so that the elderly don't end up falling, slipping, etc. And again, avoid carrying heavy items and wear sturdy shoes. So, again, to summarize, make sure that you have enough calcium and vitamin D in your diet. Be physically active, okay, with weight training exercises, walking being the best. At least walking, you'll ask me how long, what, etc. So, I always tell my patients most days of the week you can take an off on a Saturday, Sunday. So, make sure you walk 5 days a week, 30 minutes per day, exposing to your natural sunlight. And then change your lifestyle. Okay, so if you're a chronic smoker or alcoholic, you have to cut down. Okay, because that has been found in today's day and age to weaken the bones quicker than not having a calcium rich diet is also okay, but smoking and alcohol does play a detrimental role on your bones. And again, you have to be careful if you're osteoporotic and use certain braces and aids so that you will it will prevent you from falling and having a major fracture. So I would like to conclude by saying eat healthy, eat calcium, high calcium rich foods, exercise regularly, and avoid smoking. So don't let your bones age faster than you. Thank you very much. So does the audience have questions? Okay. So there's a question here. What is the correct amount of vitamin D3, calcium, and vitamin K, etc.? And can it be given to children below 10 years of age on a daily basis? Usually, we recommend that kids can get natural vitamin supplements in their diets. Okay, so there's no much panic to be created here. But then kids who have certain diseases like rickets and who are prone to rickets and already have the signs of rickets, we do give them calcium supplements. Again, 1000 international, I mean, around 400 international units of vitamin D3, and calcium is around 1000 mg per deciliter. Yeah. Okay, so my twin babies have problem in walking. Left side of the left finger is a little bigger. So this needs to be shown to a pediatric orthopedic, and you have to take certain X-rays to find out whether it's a congenital cause or not. So yes, you have to. It has to be shown at the earliest. See, flat feet in kids, causes and cures. Usually, all kids, most of the kids are born, when they are born, they have flat feet. So, if you are already prone or you are genetically inclined, then yes, you have certain exercises and the physiotherapists do help. And if it is chronic by the age of 8 to 10 years, then yes, you need to consult the orthopedician and get it treated. Is there this question? Yeah. There is a pus in the leg bone. Yeah. The fourth question, there is a pus in the leg bone and we get it operated on. Is there a possibility of any problem in the future? Pus in the leg bone is osteomyelitis. Yes, it is also known as the infection. The bone gets infected. It can become chronic if it is discharging pus with the granules. It has to be operated as soon as possible. Uh, Problem in the future can recur again if treated well, surgery well done, then it will. There may not be a possibility of it recurring. So it has to be treated at the earliest. Yeah. What causes genovalgum knock knees in children? How is it treated when it can knock? Okay. So genovalgum in children. How is it treated when it gets normal in children? Okay. So you generally children do have uh, little genovalgum. It usually gets corrected by the age of 6 to 8 years. But then, if not, then we'll have to do corrective osteotomies. Again, this can be a cause of decreased calcium or vitamin D, as I said, rickets. So one of the signs is genovalgum. So you have to go and show an orthopedician or come down to us and we will investigate accordingly. The seventh question, low calcium absorption in adults above 40 years. Again, yes, no. The peak bone mass for adults is at the age of 30 and 40. Yes, as you advance 40, for ladies the risk is more, the female population, because they enter the perimenopausal age group. So at that time the estrogen levels are less, so they are more prone to have osteopenia, which can lead to osteoporosis. Again, if there is any intestinal malabsorption syndromes or diseases, then yes, your calcium absorption can decrease. But otherwise, you can manage with normal diet and exercise. Child seems to be healthy and proper weight. So how to identify bone deficiencies? Again, if the child is normal, healthy, then I always am trying to stress there's nothing to worry about. Children will usually pick up their bone mass through bone mass index and normal calcium levels during their teenage life. It only if the child is having some chronic illness which is affecting the bones, then they'll have certain calcium deficiencies. My child is 2.5 years old. She has speech challenges. Could ortho problems lead to speech and autism issues? I don't think uh, any ortho problems like this can affect your speech. So this needs to be, you'll have to show a speech therapist and an ENT person for this. So at the most, if you want to do certain investigations, you can go ahead and show the orthopedician. I don't think there is any relationship between the speech and autism and bones. Yes, robotic knee replacement is completely safe. It is not the robot. Uh, I always emphasize on my talks. because I'm trained in robotic replacement. It is not the robot or we are sitting there behind and the robot is doing the surgery. So that is a wrong myth. Again, knee replacement is we are not replacing your knee, we are only resurfacing your knee. So that resurfacing cuts are what is going to take place with the help of a robotic arm, and that is completely safe because the readings will be guided and will be typed only by the surgeon. So yes, it is completely safe and patient specific. Spine curvature can be resolved. What type of spine curvature? Again, spine curvature in old age, kyphotic spines are common because of osteoporosis. It can be resolved in such a way, yes, through surgery. But otherwise, if it's at an early stage, bracing and physio will help. Yes. What is the maximum age for knee replacement surgery? There is no fixed age like that. So the age group is between anyone above the age of 60 is an ideal candidate. So of course, if there are certain conditions like rheumatoid arthritis which cripples your major joints, then considering it early is an option. So the next question, report shows moderately reduced medial and lateral tibiofemoral joint space in both knees. Uh, have knee pain and advised by doctor not to pray namaz. Okay, not to pray on the floor or to sit. How to reduce the pain and still continue to do daily activities. Again, if you have been advised not to squat, then that is one of the lifestyle changes. So I think you have to adhere to those lifestyle changes. You are having almost, I mean, probably if I see the X-ray, I can better comment. You will be in a phase, one of the phases of the osteoporosis, of the osteoarthritis. I'm sorry. So again, these are the lifestyle changes. Avoid climbing steps. If you have a lift, you have a fleet of steps, try using the lift. Avoid low surfaces, avoid squatting, sit on a level, quite a high chair wherein your knees are not at strain, and then certain normal exercises, strength training, and yes, you do have medications and supplements for early stages of osteoarthritis. So again, the next question, got sprain in the back, observe pain for a few seconds while leaving the bed and getting up, no problem in walking, etc. Okay, so again, there are a lot of factors to this. It could be just a muscle sprain or a muscle catch. If the climate is cold and I mean, you're at a hilly region or cold areas, then probably you have to get yourself checked and see if it is recurring often. Then you need to meet an orthopedician, get yourself checked, do the appropriate x-rays and also blood workup if needed. So yours may not be osteoporosis or osteopenia, but yes, if you are getting it, it could be a spinal problem or some nerve issue. So again, is there a free surgery for uh, knee? Is there a free surgery for kneecap transplant or replacement? Again, single joint osteoarthritis, yes, you do have um, uni knee surgeries wherein we can repair the single compartment, but it doesn't, it will prevent you from damaging or having a malalignment issue. So again, free surgeries, I don't think, because all these surgeries demand an implant, so which will come at a price. It has to be ordered, yes. So again, what is ACL surgery? It is safe. It is ACL is nothing but you have torn your anterior cruciate ligament. So what we do here is we reconstruct from your own very tissue using your own tendons from the posterior aspect of your knee. most commonly we use the semitendinosus and the semimembranosus. Hook it to an implant, which is again we hook it to a endo button or endo button like structure, and we reconstruct. Yes, it's completely safe. Yeah. So to sum up, I would say osteopenia is a catching, silent, trending disease these days in the young and the youngsters. Most of us, we are into sedentary lifestyles, AC car to AC office to AC house. So we don't have time to even, and then end up as couch potatoes in front of our televisions. So all I say is please get up. It's not too late. Get up, shake yourselves, have a brisk walk for 30 minutes, and then expose yourself at the same time to sunlight. And I think normal diet and good amount of free walking for 40 minutes will do a lot of good in your long run. In your long run. Thank you.